All right, welcome. Today, we're on a bit of a quest to understand the really complex world of spasticity treatments. And what we're going to uncover is this fascinating story, this constant push and pull between just loosening up tight muscles and actually helping someone live their life better. So, let's dive right in.
Here's the game plan for today. First, we're going to tackle the challenge of spasticity itself. Then we'll peek inside the treatment toolbox, looking at both the quick fixes and the more permanent solutions. But here's where it gets really interesting. We'll get to the quest for function, and that's going to lead us to a whole new way of thinking about the best path forward.
So first things first, before we can even start talking about treatments, we all need to be on the same page about what the problem is. What exactly is spasticity, and why is it such a huge deal for so many people?
Okay, here's the official clinical definition. I know, it sounds pretty academic, but the phrase you really want to lock onto is velocity-dependent increase in muscle tone. What that really means is the faster you try to move an arm or a leg, the harder it fights back. It's not just a stiff muscle, it's like a reflex that's gone into overdrive, actively resisting you.
So what does that look like in the real world? Well, the source material gives us these classic examples. For an arm, you might see a fist that's clenched super tight with the elbow pulled in and bent. For a leg, you'll often see the foot pointing down and turning inward. And you gotta understand, these aren't just uncomfortable positions. They can make it incredibly difficult to do basic things like walk, get dressed, or just feel comfortable. So now that we understand the problem, let's talk solutions. And as you're about to see, there is no single magic bullet here. What clinicians have instead is more like a whole toolbox, filled with different tools for different jobs, each with its own pros and cons. We can pretty much sort these tools into three main trays. First up, you've got your short-term, non-surgical stuff. Things like injections or therapies that have a temporary effect. Then you have the long-term surgical options, which are permanent changes. And finally, there's a whole category of therapies that are used alongside other treatments to really help someone get back their function. All right, let's open that first tray and look at those short-term options. These are usually the first things people try, and they're designed to give some immediate, even if not permanent, relief from that intense muscle tightness. One of the most common tools is botulinum toxin A, or BONTA. How does it work? Well, it's actually pretty straightforward. It's injected right into that overactive muscle. Once it's in there, it blocks the chemical messenger that tells the muscle to contract. No message, no contraction. The muscle finally gets a chance to relax, and the spasticity goes down. And right away, we hit the central puzzle of our entire story. The research is super clear. BONT is great at reducing muscle tone. But, and this is a huge but, when you ask if it actually helps a person use their arm or hand better, the evidence gets really fuzzy. Simply relaxing a muscle, it turns out, doesn't automatically restore its function. And that gap, that's the mystery we're trying to solve today. Okay, another tool in the box is something called extracorporeal shockwave therapy, or ESWT. This one's pretty cool because it's non-invasive. It uses these focused sound waves on the outside of the skin. The vibration is the key. It literally shakes up the tiny little protein filaments inside the muscle that are responsible for making it contract. By disrupting them, the overall muscle tension just drops. And sound familiar? We're seeing the exact same story here that we saw with BONTA. ESWT definitely works to reduce spasticity, sometimes for as long as 3 months. But when you look for the evidence that it improves a person's daily life, their function, it's just not always there. It's the same old story. Fixing muscle tone is not the same as fixing function. Okay, so if the quick fixes have this big question mark hanging over them when it comes to function, what about the big guns? What about a permanent fix? Let's talk about surgery, the options that promise a long-term solution, but also come with their own set of very big questions.
So, a major surgical player here is selective dorsal rhizotomy, or SDR. And look, this is a really intricate surgery. Surgeons go into the lower back and expose the nerve roots. Then, and this is the incredible part, they use tiny electrical pulses to test each individual nerve fiber to figure out exactly which ones are sending those faulty spasticity-causing signals. Once they've identified the culprits, they are selectively and permanently cut.
So, the big question is, does this massive, permanent surgery finally solve that tone versus function puzzle? Well, let's look at the data. Take a look at that muscle tone column. It's pretty much all positive, right? SDR works. It's very effective at what it's designed to do. But now, slide your eyes over to the function column. What do you see? Minimal effect, no change, lack of evidence. Even this incredibly powerful surgery can't escape that fundamental dilemma. It's just not a slam dunk for improving daily function. So at this point, you might be thinking, is there any solution for function? It seems like everything we've looked at, short-term or long-term, comes back to this same problem. Well, this is where our whole investigation pivots. A new clue emerges from the evidence that really changes the game. But before I show you the clue, we need to talk about why it's such a big deal. It comes from something called grade A evidence. This isn't just one person's opinion or a single small study. Think of it as the gold standard, the undisputed heavyweight champion of scientific proof. It's information that's been gathered from the biggest and best studies and analyzed all together. When something has grade A evidence, you pay attention. And here it is. This one quote from a major review in 2024 really changes everything. It says that therapies with grade A evidence lead to enhancements in functional recovery and overall well-being. But the key words there, multimodal therapies. The answer isn't about finding one perfect treatment. It's about using multiple approaches together, shifting the focus from just fixing a muscle to improving a person's whole life. So what exactly makes up this dream team of therapies? Well, the list is pretty diverse. You see some familiar names on there, right? Like shockwave therapy and botulinum toxin. But here's the kicker, the absolute secret sauce. They work for function when they are used as part of a program. They need to be combined with other proven things, like stretching, TENS units, vibration therapy. The magic isn't in any single one of these things, it's in the combination. Okay, let's bring this all home. We've defined the problem, we've looked at all the tools in the toolbox, and we've seen this major turning point in the evidence. So, what do you do with all this information? How do you actually choose a path forward? Well, it seems like the evidence is pointing us towards two main ways of thinking about this. Path number one is the surgical approach. It says for severe cases, a big, permanent surgery can be a really powerful and even cost-effective way to get muscle tone under control. Path number two is the functional approach. This one is all about combining those grade A therapies into a custom program that is laser-focused on improving quality of life. And, maybe the real answer isn't choosing one path, but blending them. Maybe you use surgery to reset the system and then bring in that whole toolbox of functional therapies to build a better life on that new foundation. And that's really what it all comes down to, isn't it? Our whole evidence quest suggests that maybe we should stop searching for a single magical cure. Instead, maybe the real future lies in becoming masters of combination, of learning how to build a personalized toolbox for each person, so they don't just have less spasticity, but can actually live a fuller, more functional life.